welcome to First Issues. Tonight on the program, we continue our conversation on obesity with Dr. Kiran Bhagat, which by definition, obesity is a complex disease that involves having too much body fat. Additionally, obesity isn't just a cosmetic concern. According to Dr. Bhagat, obesity is a medical problem that increases the risk of many other diseases and health problems. These can include heart disease, diabetes, high blood pressure, high cholesterol, and certain cancers. On tonight's Sit Down, we dive deeper into the topic. As a life-threatening medical condition, does obesity have a treatment or even a cure? Here's Dr. Bhagat. Doctor, thank you so much for coming back on First Issues. We're continuing our conversation on obesity being an epidemic globally, right? And today we want to focus on weight loss medications as a solution to obesity. Perhaps we could just start there. What are the options?
Well, because of the epidemic, there's been a race over the last 2-3 decades to develop molecules and medicines to try and for want of a better word, burn the fat. And so you have a health industry, you have a wellness industry that are selling often snake oil, on the pretext that it burns fat. We've seen these things on the market and people will consume them out of a desperation. But until very recently, most of the molecules and magic that they've been selling have literally fallen by the wayside. Literally, almost, I can say safely, 100% of the drugs that we've used in our industry, in the medical industry, has not really worked. Until the advent of, in the last probably 3 or 4 years, literally a miraculous development that has come, as most medicine comes, by what we call serendipity, which means by chance. It is a molecule that was initially used for diabetes. And what we found was that it was useful in diabetes, but the bigger thing that was discovered is that these patients lost a dramatic amount of weight.
So how do these drugs work? And maybe you could talk about them by name so that we're familiar and know exactly what solutions we're talking about.
So it's important to understand that in Botswana these drugs are not yet registered. I'm sure they're going through the regulatory drug process, but our neighbors have them and they are registered, and we are aware that patients are desperate enough to cross borders and bring them back in. The drugs that are people out there who use them know them. They go by the name of names like Ozempic. In the US and in Europe there are the brands called Wegovy and etc. But they're all basically a chemical called semaglutide. That's the proper name for it. And semaglutide or what are called insulin analogs or secretins, complicated words. Basically what they do is that they control appetite. They slow the stomach emptying, so you feel fuller faster. So in other words, they slow gastric emptying. So you have a meal, and that meal, instead of being transited within 30 minutes, takes 2 or 3 hours. So you don't feel like eating. So you lose the appetite. We also know that the chemical, when you take semaglutide, goes to the brain and suppresses appetite. We also know when you take this pill, it releases a compound that mobilizes insulin. Insulin is the chemical that breaks down the sugar, and it blocks a chemical called glucagon, which releases sugar into the body. So it's controlling the mechanisms by which glucose is burnt out and glucose is manufactured in the body. So it slows gastric emptying, it produces a heightened effect of insulin, and it stops the liver, which is the main source or the factory or the deposit from releasing sugar into the body.
With not eating for prolonged periods of time, would that not have some form of side effects, whether negative? I'm sure the positive ones would be to lose the weight, but maybe the negative ones, what are they?
The ones that are using it, perhaps in our country without regulation, would not know what the side effects are. So there are a number of side effects with this drug that we need to appreciate, that patients out there who are using it need to be instructed on, need to be monitored with. Because it slows the gastric emptying, it can cause a feeling of nausea. Some people may want to feel like they're going to vomit. Others may have constipation because it's slowing the the bowel transit. In a few situations, it causes bloating. Rarely, it can actually upset the pancreas because it's stimulating the pancreas, so it can cause inflammation of the pancreas. It can cause gallbladder issues. So these are issues that are just coming to the fore, and unfortunately, because obesity is such an issue, and as you and I know, body image is so much driven by social media, and getting into the wrong hands, particularly a younger pair of hands who are more concerned about their image, may cause it to be used and abused for cosmetic reasons rather than for medical reasons.
This discussion comes to an end next time when we discuss the future of the treatment of obesity. Until then, have yourselves a safe long weekend these Easter holidays. Good night.